Hi, I'm Dr. Bill Lanting, America's allergist. Asthma, we've talked about it. What is it? Why does it occur? What are the symptoms? But what are some of the other complications from asthma? And in children, there are two things that you have to think about. The first is that since this is chronic inflammation, it can lead to chronic airway problems. Well, what does that mean in English? Well, if you had a burn or a cut, you scar if you don't take care of it. So it's the same thing with the breathing tubes. If you don't take care of the asthma and get it under control, because there's daily inflammation, it leads to daily scarring or thickening of the airways. The fancy name we call it is airway remodeling. But again, what that means is the airway gets thick, gets a little smaller, and it's less able to open up to feel better with asthma. This thickening starts 6 to 12 months after your asthma starts, because your body does it as a protective mechanism. It thinks it's doing you a favor. But in the end, that scarring and thickening is like COPD, chronic obstructive pulmonary disease, or emphysema. The cool thing, if you have COPD from smoking, you have to live with it. But if you have COPD or emphysema from asthma, it can be reversible. And in children, it's very well defined. The studies show that if you catch asthma in the first 0 to 2 years, there's 100% resolvement or melting of that thickening of the airway. Up to 3.5 years, all or most of it will melt. But if you've had asthma for more than 5 years and then start treating, there might be some still residual or leftover thickening of the airways. But it does get better and it doesn't get worse. So again, airway remodeling or thickening, something that happens with asthma that you can get rid of or prevent with good asthma treatment. The other thing in our little guys is the growth of the lungs. Your lungs branch and grow 23 times in the first 7 years of life. Remember, the lung system, the tubes, the bronchioles and bronchi are like an inverted tree. So there's a big trunk and then more, smaller trunks, and then it gets, smaller and smaller and branches out into thousands of little airways. This growth, though, can have a problem, and that is your lungs grow like this, right? So if they're inflamed from asthma, the growth is not as good as it should be, because your lungs can either grow or deal with inflammation. They don't do both well. So if you don't get asthma under control, then you don't get full lung growth. And then once you reach 7 years of age, the factory shuts down, and what you got, you got. So if you don't take care of asthma or don't treat it properly, or you don't, you're supposed to be treating it, or you treat it incompletely, then there could be incomplete lung growth. So one of the great things about proper asthma diagnosis and therapy